of the Higher Education and Training HIV/AIDS program, also known as HATES. Dr. Ramneek, thank you so much for joining us and spending your Sunday with us here on SABC News.
It's always an honor. It's always an honor.
Thank you so much. Now, I understand that you're also part of the Symposium in Australia. You were actually present at the event in the clip that we just saw right now. How was the actual symposium, and what were some of the resolutions that came out of it?
I think it was actually the same thing, what we discussed in Melbourne and what we're discussing in East London. Basically, lots has been done and lots needs to be done. A lot has been done is because we know the virus now. We understand the medical science of the virus, how its genome looks like, what this virus is up to. But lots needs to be done in the sense we're still failing. We do not have a treatment for complete elimination of the virus. The medical science is not yet able to understand what it is. And I think what we discussed in East London was the gap. And I think the gap is very clear. And I'll give you an example where the gap is. I work in universities and colleges. So if you see University of Western Cape and UCT, they're about 5 kilometers apart. University of Johannesburg is 2 kilometers from Wits. The success of this program will only happen if I run 400 programs in this country, which are 400 campuses countrywide. A different program for University of Johannesburg, a different for Wits. So we need to understand the communities. So I think the gap is that as much as we're trying to understand medical science, we need to now understand communities, and we need to blend the communities and medical science together.
Now, some of the activists, Doctor, at the Melbourne Symposium actually were quoted as saying that, that the HIV/AIDS virus is becoming just another disease. Yeah. What makes them say that, and do you agree with that?
I think, yes. I mean, this is global picture. And now, if today we sit as South Africa, we are a very brave nation. We are a nation where there's a lot of political commitment. You've seen the minister coming out boldly saying that we're going to do 500, and it's a huge resource implication for any nation. But this is what WHO wants. So I think we as a nation is doing it. But on the other side, many other African nations, many other developing nations are not mainstreaming HIV to where it needs to be. We are a nation where civil society stands together, makes commitment with the government and work together. We have a problem, we need to accept a problem. And I think that's where the activists are trying to say, in the rest part of the world, is to learn from South Africa and say, if we have to win, we can only win if it's mainstreamed. If we understand there's a political leadership, the civil society, we all work together. And I think that's where activists are fearing, because that commitment is not there.
I suppose this also affects South Africa directly, because we do know that South Africa is one of the most infected countries with the HIV virus. But at the same time, there have been some gains. What are those significant gains?
I think a lot of gains. PMTCT has been one of the most successful programs. We are now in the world where we can boldly say that the new child that's going to be born of, even of an HIV mother, is not going to be HIV. We are a country where we are trying to say we're going to screen people. We're going with the process of 90, 90, and 90. 90 means if we can, out of the people who know HIV, 90% of them, if we can screen them and they know their status. And why is it important? If they know their status, they can get treated. And treatment is prevention. So if they are treated, see, I'm a medical doctor. I can tell you very clearly that HIV is just like diabetes or hypertension. If you have hypertension, what do? You take a pill in the morning, you look after your exercise, you look after your health, and you live longer. Similarly, if in HIV, if you can detect early, it's about testing, knowing your status early. You can suppress your viral load. So the 90%, the last 90 is 90% of the people can suppress their viral load. Even if they have an unprotected sex with anyone, the transmission virus into the other person through that sex is very minimal. So what we're trying to do is we're trying to reduce the infections.
But before we reduce the infections, we need to test first so that we can detect the virus within the system. And we know that the Ministry of Health has been extending centres, or rather is planning to extend centres and testing centres for the entire population. How important is this, Doctor? Can you emphasise the importance of this?
I think testing is the key here. And I think the minister is not going to win testing with everyone through health facilities. We all need to come on board. Every civil society, every other government department, Department of Prisons, Department of Social Development, Department of Higher Education, Department of Basic Education, schools, high schools. We need to come together, mobilize the community, ask everyone that the first priority of you is to look after your health and not stigmatize HIV. And if we do that way, we complete HIV under the wellness spheres and we bring them to the clinics, the Minister of Health will be able to test them. So I think it's a collective response. It's a community, civil society, government departments together with the DOH, and that's the key to the answer.
And then moving forward then, we have what we call the anti-retroviral therapy, which has been planned to be initiated early for, of course, HIV/AIDS patients. Take me through that, please, Doctor.
I think, as Minister boldly said in his budget speech, that from 500, even if your CD4 count is 500, we're going to start you on treatment. A mother who's diagnosed with HIV immediately during pregnancy is going to be given a lifelong treatment. Now, what happens is, if you are given on treatment, the aim is now we have to ensure that the same person is continuing on treatment. What happens in South Africa is we put on treatment, we lose the patients not taking treatment because of stigma or other reasons. We have to monitor them. So these isolated groups like schools, high schools, it's easy to monitor these people, prisons. If we monitor them, if we put them on treatment, we're going to ensure that their viral loads are going down. We're going to keep on giving them good nutrition and health advices. And as a person is taking his pills regularly, the viral load is down, he's also going to be transmitting the virus minimally to the other person, even if he has unprotected sex. So that's how we can, through ARVs, eliminate the virus in our future generation. And I think that's the key to us.
Thank you so much, Dr. Ramnika Lualia, for joining us. Thank you for sharing that information with us. And we hope to have you back again to take this conversation further.
It's always an honor.
Thank you so much. Well, that was Dr. Ramnika Lualia, the Director and Head of the Higher Education